Now we're going to check the bite fork and see that it fits in the mouth. And we've got that fully seated. And to have the patient steady that, we can take some cotton roll. The patient can usually hold it with either their fingers or they can close on it. Close on that, please. And basically what we need to make sure is that the bite fork is centered. The midline is centered, the bite fork is on the left side, and the bite fork is steady. We're now going to use the face bow to take the face bow to mount that. We're now going to assemble the mounting jig into the face bow. Each knurled knob is numbered 1, 2, and 3, and these go on the left side. And this keyhole here is where for the bite fork rod also goes on the left side. It's placed in this particular fashion, and this knob has to be tightened down snug. In this way we have this secure. All three of these have to be loosened, and we'll place it on the bite fork in this particular fashion. Lift it up and let it slide down the rod. At this point, we spread the bite fork and very gently place each into the external auditory meatus. The external auditory meatus is used as an approximation for the center of rotation. So this is 2 points for the Frankfurt plane. The third reference point for the Frankfurt plane is located right about here. There's a notch in the bony orbit on the infraorbital area right in the middle, and you can feel it right there. And what we do here is we can adjust this member to rotate the vertical aspect of the Frankfurt plane. So we'll take this and we'll slide this and we can feel that notch right about. We can feel the infraorbital notch, the bony orbit, and we use this to approximate the position. That's about right. Swing this out of the way. And we'll lock in. Okay, now we have the third reference point for the Frankfurt plane, and we'll tighten these one at a time. 1, 2, 3, and we'll go back and we'll snug them down pretty firm because we don't want this to slip after our patient leaves the office and we go back to the laboratory to mount the cast on the articulator. Now we have a recording of the Frankfurt horizontal plane using the external auditory meatus as our posterior reference points, and the third point, you find the third point on the plane in this area right here. We can spring them. We have the patient open. Slip that out. And now we have the face bow with the recording in the mouth. You will note that the plane of occlusion is a few degrees downhill. The plane of occlusion tends to parallel the ala tragus line from the tragus of the ear to the ala of the nose. The Frankfurt plane is more parallel to the floor. We're now going to take this to the laboratory and use this to mount the cast onto the articulator.